you. We're going to give everybody a couple of minutes to trickle in here to see, to maximize everyone's chance to get it all. But I wanted to, before we even make introductions, let's just chit chat amongst ourselves. I think a lot of us here have the story of that terrible thyroid situation. Mine was unusual. I think that I had not know. I knew something was wrong, right? You just don't know what it is. And I just, as a young lady in my 20s, just trying to jog the extra weight off, jogging, 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 so far, so far. And probably making things worse for myself, because by the time I did finally get my thyroid checked, my TSH was a whopping 28. So an enormous number. And I shared with that number with you a couple of weeks ago, I think, or recently, because it blew people's mind that I was functioning and jogging. Like, how did that happen? It was like, where there's a will, there's a way. Some of you guys know me already and know that I'm a little, highly focused. And so I just kept pushing, pushing, pushing. But this just represents the story, I think, of so many, and maybe on a different scale because of the extreme fitness, but recognizing that you just know it's not right. Even as a young person, I knew this wasn't it. How could I possibly continue to struggle maintaining my weight at that point, and just be on the floor with energy when I'd always been bouncing up and down, as you guys know. So anyway, from that standpoint, I know you guys have your own stories too. In my case, I have actually been on Synthroid ever since. It was so high, and so that there was no coming off of it at that point, because it was just completely shot. Sometimes it's a moment in time, and sometimes it's just, no, you're shot. You have no nutrients supporting your thyroid, and it's kind of too late. So that's kind of the situation I've been in. And so I've been on Synthroid now for 25 years. Yeah, it's a long time, right? Three babies. Like, a lot of fluctuations. So I feel like, from a personal standpoint, I've got plenty of experience here, and I know you guys do too. Who wants to? We'll finish with Lisa, because it's part of her initial presentation. But let's. Who else wants to jump in while we are waiting for attendees?
I can tell you my story. I was in my late 30s, and just like you, just knew something wasn't right, and looked in the mirror and I'm like, who is this person? I had no get up and go. I had no desire, like no interest in anything. And it was a series of things, like my vitamin D was low, and I thought, oh, this finally. And then I went to actually my gynecologist, and she had Hashimoto's, and she's like, let me just test your thyroid and I'll test your antibodies too. And it turns out I had Hashimoto's, and it took a little while. Nothing was extraordinarily terrible except the way that I felt. And it took a little while to start feeling better. But yeah, I'm not on Synthroid. I'm on NP thyroid right now. And I've been on it since 8, 9, 10 years, something like that. So and I have taken myself off of it, and it has not turned into a good thing. I become a very different person, and everyone likes me better while I'm taking my medication. So I just keep on taking it.
I'm glad to know that. And I totally understand. But the NP thyroid, you've been on that for 9 or 10 years. That's definitely, as someone who's been a Synthroid person forever, recognizing that the grass is greener on the other side, and how to make that jump is something I'd love to know more about. How did the jump go for you when you were going from Synthroid to NP?
I actually never was on Synthroid. I was on Armor for a while, and then I just from a pharmacy, I went to a different pharmacy with my Armor prescription, and they switched it to NP thyroid. So I was never on Synthroid.
Okay, interesting. All right, who's next? Who wants to go next?
You have an interesting story, huh? Oh.
Yes, I do, but it's my thyroid relatability stems from the pituitary adenoma I had, and prolactinoma with my neuroendocrine tumor, my stage 3 carcinoid cancer. So it was just like the fallout from all of that, and that left me with nodules. And I'm not on any medication, so that's why. I mean, my entire cancer survivor story is why it's what motivated me to become an expert in nutrition and become a registered dietitian, because that was the factor that healed me, was nutrition. So keeping the hormones, and neuroendocrine tumors are hormone motivated. My main hormone motivating it was serotonin. And speaking of numbers that were out of the charts, serotonin upper levels are like 200. I was in the 1300s with serotonin. You want serotonin for a great mood stabilizer, you're great. It's not good when you're growing a tumor, because it indicates some wackiness going on. My thyroid kind of took a hit with it. Again, I'm not on any medication for it, but I do pay attention to the nodules and where their growth is, and how they collect or not collect over the last 13 years since surviving the cancer.
Wow. Wow. What an extraordinary story. How long ago, or how long have you been cancer free?
13 years.
13. Ah, gotcha. Okay. Okay.
Yeah.
Well, that is phenomenal. That is phenomenal. Wow.
13 was a
What?
driver for all the thyroid issues. So that entire axis, even with the gut, that in my uh, stage 3 carcinoma tumor was in my small intestine.
Wow. Oh my gosh. It was in your small intestine. I remember you
Yeah.
telling us that at the,
Mhm.
yeah, yeah, right. It really
Yep.
pulls it all together, Trina. I feel like we should do a webinar just on your story,
Oh, my husband wants to write a book about everything else. I'm like,
right? Right. Because there's so many different
"Way."
pathways intersecting there, you know?
So I get into
Um,
the pathways a lot, and I have to like pull myself out of it. Serotonin, tryptophan. What?
Oh my goodness. Oh my goodness. What a great experience from the inside and out. And I think as professionals, having our own personal experience is really, important, because we can certainly connect with well, with the research as well as with the patients in a much different type of way, and in a much personal way. So I think that that's really, really wonderful. I'd like to go ahead and get started. Before I do, though, Kate and Grady, do you have any personal stories that you'd like to share related to thyroid?
I I know that I've used my thyroid as a scapegoat many, many times. I've gone in to, would you please test my thyroid? Because I mean, my hair is falling out. I'm cold all the time. I'm really tired and I'm gaining weight. Not putting the blame on myself, but putting it on my thyroid. Alas, my TSH was always normal, and yeah, I'm okay. So
Yeah, okay, everything's fine. How about you, Grady? Anything to share?
Well, not me particularly. With because I see patients with autism and ADHD, there is a lot of link as far as the stress response that goes on. So there's similar things dietary wise that do work together in looking at adrenal function and stress response.
Okay, well, that is the truth, and I love your perspective from that vantage point. So just fascinating to have all of you guys here together. I wanted to introduce you in the most robust ways possible. But I think it's easier to introduce you as we connect. I'll go ahead and start the slides, and then we'll go right into Lisa's story, so she doesn't feel left out, but that her story is very well interconnected with her presentation. So it makes perfect sense to be able to do that. So give me just a second to share the screen here. And I'm just going to check and see if you can see what I'm seeing. All right, so we're going to start this show. All right, guys. Can you see my screen?
yes.
Marvelous. Okay. Just a very minor technical issue. Then I'm going to go ahead and just let you know that if you need to reach me for any other technical issue, I cannot see your face. So you're just going to have to shoot me a quick text, and I'm monitoring that. Okay. Thanks for bearing with me, and we'll be all back together here at the end of the show. We are kicking off now with our adrenal Thyroid Axis webinar with some of the best experts in the business, so to speak, to help demystify what false or incomplete lab values might not be sharing with you. This is a common theme that many of us as functional nutritionists, as registered dietitian nutritionists in private practice, we come across it all day long, every day for multiple decades here between all of us. And, understanding the way the thyroid works, the influence that it has on your entire well-being, and recognize how much you can do about it all interplays. So today I'm really excited to present to you, of course, our agenda. We'll start out here talking about how the thyroid works, the parts of the thyroid, how they interconnect, the physiology of the thyroid. And we are lucky enough to have Lisa Fink, a registered dietitian who is functional medicine certified and trained, to review that physiology, followed by Kate Langbein, a functional nutritionist, a registered dietitian nutritionist, trained in functional medicine, to review the adrenal glands. So we're going to break those body parts out separately. And then Daphne Olivier, and another registered dietitian nutritionist who's functionally trained, who's also a certified diabetic educator, will be able to bring it all together, though, and how the thyroid and the adrenal glands work together to either make your life wonderful or not. So we're looking forward to that really engaging component of the presentation. I haven't seen anyone present it quite that way before, and I think that's really exciting. We'll then be getting into some dietary guidelines for the thyroid from Trina J. Hill, another registered dietitian nutritionist, this one with an MBA, who's a certified personal trainer as well and functionally trained. So really excited to see what she has to say about how to support the thyroid with nutrition. And then followed by, at the end here, Grady D. Murray, a registered dietitian nutritionist, a licensed dietitian who is also functionally trained and brings a new vantage point with his particular target market, working with a wide variety of different pediatric problems, including autism, et cetera. So really interesting to see the way that it all comes together. And so our intervention roundtable at the end will be a great opportunity for people to put in questions in the chat that we'll want to answer as many as we can. And we'll also, you'll also find out how you can even book an appointment with any of these practitioners. Insurance usually pays. So it's that worth it to your insurance company that they would actually pay for your visit, because they know it will help you so much that it will save them money. So that's great. Without further ado, we felt like we needed to do this webinar because so many people come to us with these questions that they couldn't have answered through just a standard doctor's appointment. Most regular doctor's appointments don't get into the level of detail that we are going to address today. If you do have a physician that gets into this level of detail, we would like to know her number or his number. But we hear these types of complaints all day long. Something is not right. Indications about that can go into, I always meet my activity goals on my tracker, but I keep gaining weight, or I never eat more than 1,200 calories or so, and I can never lose weight. Some people have real problems with sleep. I used to be one of those people who didn't really feel like I needed sleep. Oh, but now I sleep a lot. So those types of things we hear a lot. People who can't keep up with the pace of their life, just their energy is low, or they just feel like this sense of overwhelm all the time. Other people might feel like they are just kind of foggy, and there can be lots of other reasons for that. But if at least one of these bullet points describes you, I think you're in the right place, and you're going to get a lot out of today. There's a lot that you can do, and you're not alone. We're here, but there's a whole group of people. I think that when people gather, there's always a few thyroid in the group. So you're in the right place. We're excited to share with you how it works, so you can learn what to do about it. Happy to present Lisa Fink, again, a registered dietitian, nutritionist who is functional medicine trained, to give a fantastic overview of how the physiology of the thyroid works. Take it away, Lisa.
Well, thank you, Caroline. Well, to begin with, I would like to share with you my story, because my story may sound like a lot like your story. Just before my senior year in high school, I experienced a sudden decrease in energy. It was hard to get up and do anything. And there was a history of thyroid conditions on my mother's side, so I was immediately tested for a thyroid condition. When the testing came back, the doctor said, everything looked good. So what was wrong with me? Was it in my head? I was fortunate enough to have a supportive mother. She told me that the doctors aren't going to be able to help me, but I could do something about it with diet and sleep. And at the time, I was already exercising quite a bit through sports. So I worked on that, and slowly I was able to overcome the extreme fatigue that I felt. 7 years later, testing showed that I had thyroid antibodies, and that the doctors told me that they really couldn't do anything about it. So this experience influenced me to become a dietitian. So my hope and my colleagues' hope is that you will find some answers that will help you during this webinar. So first of all, with the thyroid, it is a butterfly-shaped gland in front of your neck. And why is your thyroid important? Thyroid hormones affect every cell and all the organs in your body, and they help control, amongst many things, metabolism, energy levels, body temperature, brain development, and reproductive function. So let's start with how the thyroid hormone production is stimulated. The pituitary gland regulates thyroid hormone production by releasing thyroid stimulating hormone, or for the acronym TSH, to the thyroid gland. When thyroid levels are low, the pituitary releases more TSH. When the thyroid levels are high, the pituitary decreases TSH production. And when the healthy thyroid gets this chemical message, it produces two hormones, T3 and T4. We will discuss the three thyroid hormones, T4, T3, and RT3. Now, the thyroid produces T4 and T3. T4 is produced in larger amounts and is then converted to T3, the active form of the hormone, as needed to upregulate metabolic functions. T3 and T4 are sent out into your bloodstream, where they're responsible for the thyroid's actual work of controlling your metabolism. Reverse T3 is the third most abundant form of the thyroid hormone. When your body wants to conserve rather than burn energy, it will divert the active T3 into an inactive reserve form. So T3 can be considered the metabolic accelerator, and RT3 would be considered the metabolic brake. Now, just to note that T3 and RT3 can compete for binding sites. So if there's more RT3, then there's less binding sites for T3. And some of the factors that increase the conversion of RT3 are stress, trauma, low-calorie diet, inflammation, toxins, and infections. So where does the conversion of T4 to T3 take place? Well, 60% of conversion of T4 to T3 occurs in the liver. And if there's a liver dysfunction, such as non-alcoholic fatty liver disease, it is associated with diminished thyroid action. 20% of conversion of T4 to T3 occurs in the GI tract. And there's accumulating data that a strong thyroid gut axis exists. So dysbiosis is a common finding in thyroid disorders. And also dysbiosis may also cause malabsorption of essential nutrients for optimal thyroid function that will be discussed later in this webinar. And approximately about 20% would be converted to reserved RT3. Now, thyroid hormone is the key regulator of resting energy expenditure, REE. REE is often used interchangeably with BMR, the basal metabolic rate, and is defined as the minimum amount of energy necessary to maintain the individual alive and awake in a steady state of energy balance. Thyroid hormones interact and influence most metabolic pathways in virtually all systems, because thyroid hormone receptors are ubiquitous. When there's a change in the thyroid status, it is associated with changes in weight and REE. When there's a reduction in REE, it results in weight gain and can lead to obesity. When there's an increase in REE with an overactive thyroid, it may cause weight loss. In healthy individuals, variations in serum TSH, even within the reference range, are associated with body weight changes in both men and women. And it also has a critical role in regulating energy levels. kind of go back to how I felt. When thyroid levels drop, energy levels decrease, causing fatigue and weakness. And with an overactive thyroid, it can cause increased metabolism, which can lead to exhaustion. So clinical studies confirm that hypothyroidism is associated with a reduction in cognition. In addition, some other symptoms may be forgetfulness, difficulty focusing, mental confusion, mood disturbances, brain fog. Those are all those things that somebody may feel. There are two types of hypothyroidism. The first to discuss is a non-autoimmune hypothyroidism. This condition occurs because the thyroid gland is not functioning well. It can be caused by several factors, including nutrient deficiencies, excess iodine exposure, excessive exposure to certain foods, various challenges that prevent the body from effectively converting inactive thyroid hormone to the active form, or the inability of the body to effectively use the thyroid hormone. In some cases, the body is making enough thyroid hormone, but T3 is converted into RT3, which is the inactive form that the body stores instead of uses. Now, the most common form of hypothyroidism is Hashimoto's. And this is when the body's immune system has developed antibodies that are attacking the thyroid tissue. This will cause inflammation, which disrupts normal function and will damage the thyroid. Over time, the damage can prevent your thyroid from making enough thyroid hormone that the body needs. This leads to hypothyroidism. When this occurs, the thyroid has trouble producing T3 and T4. Now, TSH is produced in an increasingly high amount to try harder to stimulate the thyroid. However, not everyone with Hashimoto's has hypothyroidism. And then another point of information is that there's more data coming out linking microbes in the gut that may trigger autoimmune thyroid disease. And next is hypothyroidism, and this is when the body produces excess thyroid hormone. Now, the most common cause of hyperthyroidism is Graves' disease, and that is an autoimmune disease which your immune system attacks healthy tissue in your thyroid gland for unknown reasons. And the most defining symptom of Graves' disease is the bulging eyes. Other symptoms include weight loss, heart palpitations, and insomnia. But hyperthyroidism is relatively rare, only affecting about 1% of the people in the US. Now, what are some of the common symptoms that may warrant thyroid testing? Some of the more common ones that we see is more like brain fog, constipation, depression, fatigue, menstrual disturbances, slower heart rate, slower mental processing, and weight gain. So have you ever gone to the doctor to get thyroid testing, like me, and he will say, everything looks good. So you wonder, oh my, if something else is wrong, or maybe it's just in my head. So in this chart, I've included standard lab ranges and functional lab ranges. Functional ranges are typically narrower, and the labs included in the chart are the ones that would be best in determining a patient's need. So if you recall, the job of the thyroid stimulating hormone, TSH, is to tell the thyroid that's time to get busy producing more thyroid hormone. But the normal range for TSH is somewhat controversial. However, many integrative and functional medicine doctors find that their patients feel their best in the range of 1.5 to 2. Now, free T3 and free T4 are called this because they are not bonded to proteins and are free to perform their work in your cells. This is important to keep your metabolism at a level for optimal health. Measuring FT3 and FT4 is important to determine if there are enough active hormones in your circulation. Reverse T3 is measuring this inactive reverse form, and the two thyroid antibodies are thyroid peroxidase antibody and thyroglobulin antibody. So let's review real quickly some potential lab results. So if you have a high TSH and a low FT4 and FT3, that indicates hypothyroidism. What if you have a normal TSH, a normal FT4, but you have a low FT3, and that could indicate T4 to T3 conversion problems? And then what if you have a normal or high TSH, normal FT4, and a high FT3? That could indicate cellular resistance to FT3, which can still lead to hypothyroid symptoms because the active hormone can't get to the cell to do its job. And then there's a high RT3 level, indicates that too much T4 is being converted to RT3 and not enough to FT3. As mentioned earlier, that FT3 and RT3, they will compete for binding sites. And then the presence of thyroid antibodies is used to diagnose Hashimoto's disease. So kind of getting back to my story, which may sound a lot like yours again. My lab showed that TSH was normal. T3 and T4 were not tested. Later on, the thyroid antibodies, they were tested to be high. And my healing has been a journey and continues today. I actually did not take any levothyroxine or any type of thyroid medication because it really didn't do anything for me. But I did have gut dysbiosis that needed to be healed. And once I got that healed, and then I needed some more adrenal support, once I got that going, I felt much better. But I had to continue eating whole foods with no added sugar intake because that's essential for my healing. Now, sleep and stress were, and they're still huge, but my colleagues will be presenting more to help you in your journey.
Okay, fantastic. Fantastic. That was great. Thank you so much for not only sharing your story. I'm sorry, I'm fumbling around with the slides here. But not only sharing your story, but also just making it so relevant. I think that it's so relatable to so many things that so many people are dealing with here, and breaking down the labs the way that you did, helping us understand between hyper, Hashimoto's or autoimmune, whether it's subclinical sort of autoimmune or actually diagnosed Hashimoto's versus, hypothyroidism caused by something else. Really, there's a lot in the labs that you can get at a doctor's office. So kind of asking a physician or NPA or IPA, just what labs would be complete, to at least start there to see if you can identify the next thing. Okay, so moving on from thyroid. Oh, thank you, Lisa. On to Kate Langbein, a dietitian extraordinaire, known Kate for a really long time, and I am excited for her fabulous presentation here. Kate, take it away.
Great, thank you. Good evening, everyone. I'll be giving an overview, as the slide says, of the adrenal glands and their crucial role in our health. The adrenal glands are two small triangular shaped organs. They are located at the top of the kidneys, but despite their size, they play a major role in our overall health. One of the primary functions is managing our stress response. So when we encounter a stressful situation, which many of us do, the adrenals release hormones like cortisol and adrenaline, preparing our body for that fight or flight response. But the role goes beyond just stress management. The adrenal glands also help control metabolism, regulating how we use energy from food. Through cortisol, they influence blood sugar levels, fat storage, and even our weight. Another critical function is in blood pressure regulation. So the adrenal hormone aldosterone helps balance sodium and potassium levels, which is essential for stabilizing our blood pressure. And then lastly, adrenal glands also support the immune system, helping us fight infections and recover from illness. So in short, these small glands are essential for keeping us healthy and balanced in our everyday lives. Next. The adrenal glands are made up of two key sections, the adrenal cortex and the adrenal medulla. The cortex is the outer layer, and it produces several important hormones. Cortisol, as I mentioned, regulates stress, metabolism, and blood sugars. Aldosterone, which was also mentioned, controls our sodium and potassium, but it also helps, and again, to help regulate blood pressure. And then sex hormones. The cortex also produces small amounts of androgens, which are male sex hormones, and they influence growth and development. Yes, even in ladies, women. So the adrenal medulla, which is the inner core, produces adrenaline and noradrenaline. These hormones are critical for that fight or flight response, increasing heart rate, raising blood pressure, and boosting energy during stressful situations. So together, the cortex and medulla ensure the body can effectively manage stress, regulate energy, and maintain essential balance across our different bodily systems. Next. All right, so often labeled as a stress hormone, cortisol is released through a system called the hypothalamic pituitary adrenal axis. When we encounter stress, the brain signals the hypothalamus, which triggers the pituitary gland and finally prompts the adrenal glands to release cortisol. Now, this HPA axis will be covered in greater detail later on by my colleagues. And once we release the cortisol, it helps the body cope with stress by regulating blood sugar levels, ensuring the brain and muscles have enough energy. It controls metabolism, so it affects how the body uses carbohydrates, fats, and proteins, reduces inflammation, which protects the body during prolonged stress, and boosts energy availability to respond to physical or emotional challenges. And finally, this finely tuned response is crucial for managing the short-term stress. All right, so cortisol is not only essential for managing stress, but also plays a critical role in regulating energy, mood, and inflammation. So when it comes to energy, cortisol helps break down fats, proteins, and carbohydrates, ensuring the body has enough energy available to meet its demands. However, imbalances in cortisol, either too much or too little, can lead to fatigue and blood sugar levels, so it may not be very well regulated at those times. Cortisol also impacts our mood by influencing neurotransmitters like serotonin and dopamine. High cortisol levels are often associated with anxiety, whereas low levels can contribute to depression. Cortisol also has a strong anti-inflammatory effect, helping to control inflammation in the body. However, if cortisol remains elevated for too long, it can actually suppress the immune system, leaving us more vulnerable to illness. This balance is crucial to maintaining both physical and mental well-being. Now we understand cortisol's role, let's explore some common adrenal imbalances. So when the adrenal glands produce too much or too little of these crucial hormones, it can lead to significant health issues. So one common concept in integrative medicine is adrenal fatigue, which suggests that chronic stress can cause the adrenal glands to underperform. This can result in ongoing fatigue, trouble sleeping, and difficulty managing stress. A lot of us know about that. Another condition is Cushing's syndrome, where the body produces too much cortisol, leading to symptoms like weight gain, particularly around the abdomen, face, and upper back, and as well as high blood pressure and bone loss. And then finally, we have Addison's disease, which occurs when the adrenal glands produce too little cortisol due to damage. This can cause severe fatigue, low blood pressure, and weight loss. Let's start with the adrenal fatigue, go into a little more detail with it. So while it's not officially recognized in mainstream medicine, many people report experiencing symptoms like excessive fatigue, difficulty falling or staying asleep, salt and sugar cravings, low blood pressure or feeling lightheaded, brain fog, and a reduced capacity to handle stress. The main causes of adrenal fatigue are prolonged stressors causing the adrenals to be overtaxed, a diet consistently high in processed foods, sugars, and stimulants like caffeine, inadequate sleep causing disruption in our circadian rhythms, or those 24-hour biological clocks, demanding employment, that's my PC term for being overtaxed at work, and prolonged exposure to illness. A holistic approach focuses on improving diet with nutrient-dense foods and adequate hydration, as Elisa alluded to earlier, incorporating supplements like B vitamins and adaptogenic herbs, managing stress through relaxation techniques like yoga or meditation, sleep hygiene practices, of course, and consistent intentional movement. Next, let's discuss Cushing's syndrome, a condition characterized, again, as I said, by weight gain, particularly around the abdomen and face. It also is noticeable with thinning skin, high blood pressure or blood sugar levels, fatigue, bone loss, and mood changes. So this syndrome is caused by excessive cortisol production. Common causes include long-term use of corticosteroid medicines like prednisone for chronic conditions such as asthma, as well as tumors in the adrenal or pituitary glands. Now here's a mouthful. Adrenocorticotropic hormone, or ACTH, which I much rather call it that, is normally produced in the pituitary gland, which we've gone over, and that stimulates the adrenals to produce cortisol. But in ectopic ATCH syndrome, a tumor outside that pituitary gland secretes ACTH, leading to uncontrolled cortisol production. So that's another cause. So treatment really depends on the cause and may involve surgery to remove the tumor, radiation if surgery is not successful or fully effective, or adjusting corticosteroid use, of course, under medical supervision. And then additionally, medications that lower cortisol production could potentially also be prescribed. Another serious imbalance is Addison's disease, where the adrenal glands fail to produce enough cortisol. So symptoms include severe fatigue, weight loss, low blood pressure, still those salt cravings though, but darkening of the skin as well in certain areas. Now, Addison is often an autoimmune condition where the immune system attacks the adrenal cortex, but it can also result from infections like tuberculosis or fungal infections, or even from genetic conditions. So treatment for Addison's disease typically involves lifelong hormone replacement therapy to restore cortisol and aldosterone levels. It is also important to adjust hormone doses during times of stress, like if you're sick or if you're having surgery. Now, patients also need to ensure adequate salt intake, ironically enough, because those with Addison's often struggle to retain enough sodium. Now, maintaining adrenal health is all about finding balance. And the key to this is stress management, practicing, of course, mindfulness, yoga, breathing exercises, which can significantly reduce stress levels. Nutrition is also critical, eating a balanced diet, rich in those whole foods, healthy fats. Minimizing the processed sugars, of course, helps support both energy and mood. So there are supplements also, like omega-3 fatty acids, vitamin D, those adaptogenic herbs I mentioned earlier, maybe rhodiola or holy basil, and these can help restore adrenal functions. So finally, regular moderate exercise plays a vital role in maintaining cortisol balance, so because it doesn't overtax the adrenal glands. So this holistic approach ensures that the body's stress response remains in check, hopefully while promoting overall adrenal health as well. So to wrap it up, the adrenal glands are essential for managing stress, but also regulating energy, mood, and inflammation. Cortisol, the primary hormone produced by the adrenal, plays a key role in these processes. Adrenal imbalances, whether too much or too little, can lead to various health challenges. So by following lifestyle and nutritional strategies, we can support adrenal health through an approach that includes stress management, proper nutrition, and balanced exercise. Now, my colleagues will elaborate further regarding these strategies throughout the remainder of the presentation.
Wow, Kate, that was so thorough and fantastic. Thank you so much. So between Lisa going through the physiology of the thyroid and Kate going through the physiology of the adrenal glands, we've been very science intensive, and we're going to take it up one more notch here so that you can really see how these two components play together to either support your lifestyle or wreak some havoc. So let's welcome Daphne Olivier to be able to really review how everything plays together here. So thank you so much, Daphne, for making easy work of this very complicated circumstance. If you're listening, bear with us. You're just about to have that breakthrough.
All right, so I'm going to reiterate some of the things that both Lisa and Kate said and kind of try and pull it all together and give it a little bit more application maybe to you. Okay, next slide. Okay, so it's kind of small and hard to read, but this is what we call the HPAT axis, which is the hypothalamic pituitary adrenal thyroid axis. And what that means is that they all work together. So they're very much, it's not a one-way street, it's very much a highway that has multiple roads on it. So if you look on the left side of this picture, you'll see that we're going to go through what happens with the adrenal glands first. So it starts with the hypothalamus, which is a part of the brain. So it's in the back of the brain here. And the hypothalamus is what dictates what happens downstream. So again, kind of going down the left side, if you go straight down, the hypothalamus produces the hormone called corticotropin releasing hormone. And so that's going to tell the pituitary gland to send a message, and that's through the adrenocorticotropic hormone. Whew, that's a mouthful. That's the one that Kate said that we're going to call just ACTH. So the pituitary gland sends the message through the hormone to the adrenal gland, and the adrenal gland creates cortisol. So if you see on the left side that the arrows go back up, and so we're going to explain to you that this, like I said, it's a bidirectional highway, meaning that the hypothalamus is releasing hormones going down, and then those hormones go back up and talk to the hypothalamus. So if we look on the right side, the hypothalamus creates or produces TRH, which is thyrotropin releasing hormone. to tell the pituitary gland to produce hormone. And so the pituitary gland produces TSH, thyroid stimulating hormone, to in fact stimulate the thyroid to make hormones. So if you're going to the doctor and they are evaluating your thyroid function based on your TSH, what they're really looking at is how much hormone is being produced by the pituitary gland to tell the thyroid to make hormone. So as Lisa mentioned earlier, the thyroid makes two primary hormones, T4 and T3. So if you're just getting your TSH tested, you're not getting tested actually what your thyroid is producing. So again, your T4, T3 hormones will go back up and talk to the hypothalamus and talk to the pituitary gland to adjust and fine tune when hormones need to be produced. So the interaction between the two is the high cortisol level. So if your adrenal glands are producing a lot of cortisol, it's going to, like I said, kind of go back up and talk to the hypothalamus and talk to the pituitary gland, and that's going to reduce the hormones that are being produced downstream. It's going to reduce them. And likewise, on the thyroid side, if you have high thyroid hormones, the T3 and T4, it's going to reduce the hormones that are going downstream coming from the pituitary gland. So these are what we call feedback loops, and this is what's called the axis. This is what makes up the axis. And these loops help to balance stress, your metabolism, and your energy level. So there are essentially two main focuses whenever, so it's pretty unlikely that you'll ever have just a thyroid problem or just an adrenal problem because they are so interactive together. So I call them sister glands. So the two main parts or areas where you're going to find the most challenging whenever you have either a thyroid or adrenal problem is blood sugar balance and inflammation. And so if your thyroid is acting up and you don't have great thyroid function, those lowered thyroid hormones are going to make it harder for your body to balance blood sugar. It can cause low blood sugar, which is called hypoglycemia. And you may not ever know that you have low blood sugar because your adrenals kick in and they start releasing cortisol, and cortisol will bring your blood sugar up. So you may not have, if you've seen someone that has hypoglycemia where, you know, if the most extremes people will faint or pass out, you're not going to have any of that because your adrenals kick in and make that not happen. You may not feel good, so you may feel drained, but you're not going to probably have an extreme hypoglycemic reaction. But if you're having low thyroid hormones over a period of time and your adrenals are always having to come to the rescue, then it can lead to adrenal insufficiency where your adrenals just get tired and they're tired of having to save the blood sugar balance all the time. On the flip side of that, if you start with more adrenal dysfunction or adrenal issues, and your cortisol is really what helps to regulate blood sugar, and you're having lots of highs and lows, that the stress of highs and lows can further create more cortisol production, and the imbalance of the cortisol production can affect the thyroid hormones. So they both work synergistically to help with balancing blood sugar. In addition to this, which we haven't talked about really diabetes or any other insulin related issues, but if you have insulin resistance, either because of PCOS, polycystic ovarian syndrome, or if you have insulin resistance before the presence of diabetes being started, that further complicates this whole situation because, again, you're having more blood sugar imbalances, which are taxing the thyroid and taxing the adrenal glands at the same time. So the immune system also can get dysregulated whenever we have these glands that are imbalanced. So if the thyroid is imbalanced, the thyroid imbalances or inadequate hormone production from the thyroid increases inflammation. And that's just kind of low-grade systemic inflammation throughout the body. So as Kate mentioned, cortisol is an anti-inflammatory hormone or anti-inflammatory hormone. And so whenever your inflammation starts to rise for whatever reason, cortisol production increases. So a lot of people live with just long-term, low-grade systemic inflammation. And so you're constantly needing that cortisol production to be increased in order to manage the inflammation. So again, with that constant cortisol having to be produced, your adrenal glands just get tired. That's why we call them fatigued. They get tired of having to produce hormone all the time. On the flip side, if your adrenals, go back.
Oh, sorry.
If your adrenals are impacted, it's going to affect your thyroid, because if your adrenal glands have either excessive or low cortisol, it's going to disrupt the inflammation, or your ability to control inflammation. And what that can lead to with inflammation, it can lead to Hashimoto's thyroiditis. So we talked about that a little bit earlier. Hashimoto's is more of an inflammatory immune process. And then that chronic inflammation continues to wear down the thyroid. So it happens, again, it's like a seesaw, it happens both ways. All right, so the disruption can happen if you have the HPAT. So again, that's the hypothalamus, pituitary, adrenal, thyroid axis disruption. If you have under-functioning thyroid, it impairs everything by the reduction in the cortisol production. Eventually, that will cause fatigue, where you feel just drained and tired, low blood pressure, and poor stress response. So it took me a really long time to understand what poor stress response meant, but when I felt it, I understood. And essentially, it's just kind of, and everything feels overwhelming. The small little things, life just feels overwhelming. And so that's your inability to really manage and deal with just everyday stressors. So when your thyroid is, go back one more time. So on the flip side, reduced metabolic rate can happen if you're not producing enough thyroid hormones. It is going to slow down your metabolism. It's going to decrease your ability to absorb nutrients. And so that's overall going to suppress or decrease your metabolic rate. All right, so if you have some adrenal issues, it is going to eventually, that high cortisol, and the high cortisol could come because of something like tumors. It can come from just stress, more than likely going to be from just our everyday life stressors. That high cortisol suppresses the TSH, so that's that thyroid stimulating hormone. And so decreased TSH, remember, that is what triggers the thyroid to produce hormone. So if the TSH is low because of high cortisol, it's going to reduce the thyroid's ability to make hormones, and that's going to look like or present as hypothyroidism. Then you can also have reduced cellular sensitivity. So that means that your thyroid's making hormones, but the elevated cortisol doesn't allow each individual cell to be able to utilize that hormone very efficiently. So this would look like you're stressed, your cortisol levels are high, your thyroid hormones are tested and they're fine, they're appropriate, but on a cellular level, your cells can't use that thyroid hormone efficiently. And that's usually because you have too much of that reverse T3, that RT3 that Lisa was talking about. All right, so another thing is that, and again, kind of going back to what Lisa was talking about, the chronic stress can impair the body's ability to convert T4 hormone, which is what we produce more of. That conversion can be impaired if there's a lot of stress, again, causing that reverse T3 to be elevated. And additionally, your adrenal glands and your thyroid glands both use a tremendous amount of nutrients. So oftentimes, I think people think about food and we think about, carbohydrates, protein, calories. We're not really thinking about the nutrients, the vitamin B, the variety of vitamin B, the riboflavin, the thiamine, the zinc that's found in foods. But those are the individual building blocks and nutrients that our body actually uses to be able to run and function on a daily basis. All right, so the keys to maintaining balance, and again, this is just a little touch of what my colleagues will be talking about. To maintain balance between thyroid and adrenal function, we have to be able to manage stress, and that essentially means we're not getting rid of stress. Everyone has stressors, but we have to be able to manage how we respond to them. So managing stress, adequate sleep, and I think of sleep as both quality of sleep and quantity of sleep. So we can usually impact our quantity of sleep. Quality of sleep is a little bit harder, a little bit more nuanced, but we need both good quality and quantity. And then, of course, we have to give our body the nutrients that it needs so that not just our adrenal and thyroid glands, but that everything can function at its best and its optimal function.
Wow. Okay. So Daphne, sorry about the trigger finger on that one a couple of times. Okay. Thanks for soaring right through there. I also love the way you called it a bi-directional highway, because I felt like I saw at least 10 directions on that highway. And, it's a complicated but interconnected system that needs to depend on each other. So, all the traffic needs to be going the correct way on that multi-directional highway. So great analogy there. And thanks for, that concise description of a very complicated couple of systems together. I'm excited to find out what to do about it. So I'm very excited to welcome Trina J. Hill, a wonderful registered dietitian who is going to be able to, really review this specifically from the thyroid perspective. So take it away, Trina. Help us figure out what we can do about it.
Thank you, Caroline. It's so good to be with everyone this evening. So when it comes to dietitians and our approach to medical nutrition therapy, or MNT, you hear me say for short, we approach it in various ways to assess this thyroid, adrenal related problems and complaints, apply a nutrition diagnosis, intervene to offer solutions with nutrition education, counseling, or just coordinate care with other colleagues. Ultimately, monitoring and evaluating, and sometimes reevaluating the intervention plan facilitates changes or even resolutions to the original plan by reassessing comparative data, reports, and observations. This format is an excellent tool that we use to help organize the flow of your nutrition appointments, and it is a wonderful process that is documented by your nutritionist. This format helps to ensure, most of all, the best continuity of care among health professionals involved in your treatment. Okay, we've heard so much good nuggets about the thyroid. So just simply put, if you're diagnosed with a hyperthyroid, it is overactive, it's high performing. And if you're diagnosed with, a hypo or a low performing thyroid, that's simply just the overall umbrella terms that were used to describe thyroid performance. All right, here's the good stuff. Weight and energy balance are just the hallmarks and the primary presentations of adrenal thyroid irregularities. Thyroid hormones play an important role in the regulation of energy expenditure. Energy that we get from food. Gotta love food. We love food. We need it. That energy our body needs to use so we function. The thyroid affects the behavior of many of the body's metabolic reactions, whether there is an excess or deficiency in thyroid hormones. Essentially, thyroid disorders can change the sequence or regulation of metabolic processes inside our body cells, as you heard Daphne mention a moment ago, and those tissues that are made by those cells. The nutrients we take in, like carbs, starches, and sugars, protein and fats, as well as our ability to properly digest and absorb them for energy use, is impacted by thyroid imbalances. For instance, the breakdown and formation of carbs for energy can be disrupted if hormones signal one or the other to occur out of order or at the same time in one direction or the other. That's how our body works. Beautiful, complicated machine, right? Protein synthesis can be chaotic as well, leading to harmful breakdown or excuse me, or catabolism because of the high doses, muscle weakness and loss of muscle function, which happens in an overactive thyroid. The regulation of fat, metabolism, and cholesterol production can also be disrupted and create problems like obesity and fatty liver disease. MNT for hyper or that overactive thyroid can generally, but not conclusively, as we learned earlier in the presentation from my colleagues, just a general statement, can be indicated by elevated T3 and T4, low TSH, or by investigating, which is what we pride ourselves in doing as dietitians and functional nutritionists, is getting that investigation process of unexplained weight loss. And those problems include rapid heart rate. A rapid heart rate is most often described above 90 upwards to 100 beats per minute. Loss of bone density. This happens because calcitonin is produced in the C cells in the thyroid gland, and which lowers calcium levels in the blood when they are too high, thus regulating that amount of calcium in the blood. Anemia is another problem that can occur in hyperthyroidism as a result of increased red blood cell production that's breaking down and or is being stored in a protein called ferritin, and it's a high ferritin levels that indicate that type of anemia. Symptom treatment and response is increased caloric intake to address the high BMR, the main factor in weight loss. The dietary intake favors a this dietary intake favors a vegan vegetarian type diet because high protein levels can cause muscle weakness and loss of function. Graves' disease, as you heard earlier, is the appearance of an enlarged thyroid or goiter from insufficient thyroid hormone synthesis. Genetics and stress are the most common causes of hyperthyroidism. Excessive dietary iodine intake and iodine rich medications and supplements can also contribute to an overactive thyroid gland. Surgery may be indicated in hyperthyroid patients who have an obstructive goiter that blocks the trachea or your voice box. So MNT for hypothyroidism can generally, again, generally not conclusively, be low when it's low to normal T3, low T4, or high TSH, or after investigating unexplained weight gain, problems like feeling cold or very high sensitivity to cold, hair loss, dry skin, constipation, and anemia. This anemia is seen in hypothyroidism as decreased red blood cell production, low iron, low folate, low B12. Symptom treatment and response begins with reduced caloric intake that addresses the low BMR, the main factor in weight gain. The dietary intake guards against a vegan vegetarian type diet because the focus is on protein intake. Recommended protein intake is generally zero point 0.8 grams per 8 grams of protein per kilogram of body weight per day. This may increase to upwards to 1 gram of protein per kilogram of body weight per day in some pregnant and lactating women. Dietary intake targets a reduction or elimination of gluten, processed soy, excessive uncooked goitrogenic foods, and stress. Hashimoto's thyroiditis is a common diagnosis, but does not happen to all who have a low performing thyroid. This is when the system attacks and destroys the thyroid gland. Medication management and knowing if the thyroid has been surgically removed are also important considerations. Would you go back? Got finger
Oh,
down on the slide. Yeah, I was a little ahead. Now I'm on that slide now. Thank you. All right. So thyroid recovery. So we're going to try to get some relief here. The thyroid recovery can focus on goitrogenic foods, as I mentioned earlier, as goitrogens trigger the pituitary gland to release TSH, which then promotes growth of thyroid tissue, leading to a goiter. These compounds can also interfere with the iodine uptake in the thyroid gland. Nutrients that are significantly impacted by thyroid disorders include iodine, iron, selenium, and vitamin A. The recommended dietary allowance, or RDA, for iodine is 150 micrograms a day. The average intake in general populations is anywhere from 175 to 240 micrograms a day. We find iodine in seafood and iodine. Excuse me. We find iodine in we find iodine in seafood and soil, milk, cheese, and eggs. Potassium iodide is a common supplement. Also the RDA for iron, another nutrient that gets impacted and is common deficiency. This RDA varies for ages of all ages across the spectrum, but it is highest in pregnant and lactating women, infants, and children. The general range is from 7 to 27 micrograms a day. RDA for non-pregnant and lactating women is 18 milligrams per day. RDA is highest in these two populations. The classifications of anemia, as we described earlier, may vary because not all iron deficiencies are triggered, or not all anemia is a result of iron deficiencies. So be careful about just taking an iron supplement because you feel that you need iron. So beef, meat, liver, seafood, nuts, and grains are also great food sources of iron. The RDA for selenium, another deficiency, common deficiency, is 55 micrograms a day. Selenium is good for immunity, body temperature regulation, and our BMR, or that resting energy expenditure. So Brazil nuts are the number one and the highest food item that has selenium in it. It comes from that rich soil in that region of the world, and there are actually six nuts that can contain up to upwards of 400 micrograms. So just six nuts. And personally, I do not like Brazil nuts, so I hope I'm not deficient in selenium. So seafood, meats, nuts, grains, and enriched foods are also great sources of selenium. Now moving on to vitamin A. Everybody's familiar with that. Vitamin A is our fat soluble vitamin, and the RDA for vitamin A is 700 micrograms for women and 900 micrograms for men per day. Again, this is a fat soluble vitamin, so we have to take caution with toxicity because toxicity can set in when we have too much of it unnecessarily because it's stored in the fat in our body. So that would mean taking 10 times the amount of what the RDA recommends. So our vitamin A deficiencies is seen in iodine deficient induced goiters most often. Beef, cod liver oil, fortified foods, yellow, orange, and green veggies are great sources of vitamin A. So, a well balanced diet, as we all know, that includes protein, healthy fats, and carbohydrates can help support adrenal health and recovery. Foods like lean meats, dairy, eggs, nuts and seeds, whole grains, and healthy fats like olive oil. Magnesium and B vitamins are important for reducing stress, anxiety, and depression. The RDA for magnesium is 350 milligrams per day. Magnesium helps reduce the release of cortisols we heard so much about from Daphne and lessening the stress response. Magnesium is also a great supplement that encourages sleep as well. The RDA for B vitamin 6 is 1 to 2 milligrams per day. The RDA for B9 folate is is excuse me, B9 folate is measured in dietary folate equivalents, or DFEs, and range from 65 micrograms in infants to up to 600 micrograms per day for pregnant and lactating women. RDA for B12 ranges from 0.4 in infants to 2.8 micrograms per day in pregnant and lactating women. Vitamin B6, B9 or folate, and B12 help balance brain reactivity and that response to stress. Production of serotonin, that mood neurotransmitter, is definitely impacted by this B vitamin complex. Formation of hormones from the adrenals or catecholamines is benefit very much from the B vitamin complex. Alternative natural medicinal plants support adrenal health and recovery in the same way. Supplements like ashwagandha and rhodiola rosa are generally regarded as safe and should be monitored for potential reactions with other prescribed medications. Recommendations are for short-term use, generally 2 to 4 months. 300 to 60 milligrams per day of ashwagandha is suggested. Ashwagandha contains adaptogenic properties that help cope with stress, anxiety, and fatigue. Also, it helps decrease cortisol and reduce symptoms of stress, depression, and anxiety. 100 to 600 micrograms of another helpful herb, rhodiola rosa, is suggested. This is good for reducing anxiety and stress levels as well. There's also some inconclusive research on its effect on cortisol levels. Although physical activity is often recommended for stress relief, trying to exercise safely with adrenal dysfunction can definitely be a challenge. Many forms of exercise can increase the level of cortisol the body releases, which can also slow adrenal recovery. So don't go out there doing, if you have an adrenal dysfunction, don't go out there doing HIIT exercises that may create more stress. And the adrenals respond to that stress because they fluctuate between high cortisol levels, trying to meet the demand to reduce stressors. Then the levels decrease as the body becomes depleted, as Daphne discussed earlier, because it's unable to meet the demand. So low impact exercise only when you're in a heightened state of adrenal fatigue or insufficiency. Variable environmental and social factors affect cortisol levels, as we well know. Overall, the relationship and dependencies within the adrenal thyroid axes are clear, and recovery is definitely possible when it comes to getting medical nutrition therapy.
Okay, so I think that wraps that one up, right? That's the last slide. Thank you so much, Trina. Oh, great job getting to the nitty-gritty of the details and the numbers. I was really excited that you brought up, of course, iodine. I think it's interesting that it's only 150 micrograms per day, even though the average intake is excessive of that. I also see that there's a lot of supplements that have excessive iodine in them, and too much can hurt. So that was amazing to at least just throw that number out there to kind of keep that in mind. If you see those adrenal or those thyroid support supplements, just make sure that they're not in excess of that 150. And then what you said about the iron was really fabulous too. I think that's so interesting how, immediately if we think we have low iron, we think we must have to supplement. Yet so often, like you said, it might actually have to do with absorption. So thanks for making that really clear. I think that's that blows people's minds when they start to look at it differently that way. Like, you don't just replace what you are deficient in, you just make sure that you utilize what you are taking in better. So really fantastic presentation. Thank you so much for the details on this one. And now we can turn it over here to Grady Murray. He is going to review nutrition approaches, of course, for adrenal health, but also kind of getting into some of that absorption as well as Trina led up to. So a little bit of overlap between the thyroid and the adrenal approaches to nutrition, as it should be. But I'm excited to get into optimizing the absorption of nutrients in this part of the presentation, Grady. So thank you so much, and take it away. Oh, Grady, I think that your mute is on. If you can play around with that one there for a second. I'll just take a second.
I'm here.
Oh,
if you can go
yes.
back a slide.
Perfect.
Perfect. Thank you so much. And hello, everyone. What amazing information our presenters just gave to us. And thank you to our colleagues. My name's Grady Murray. I'm a registered dietitian, nutritionist, and founder of Pineapple Pathway. Today, I will be continuing the nuggets of knowledge on adrenal health and nutrition. I'll also give a little peek at gut health too. But first, I would like to tell you a little bit about my nutrition platform. I specialize in autism spectrum disorder and ADHD in the pediatric population. And I feel very fortunate because I also get to work with their parents. And, you know, each of them come with their own health and nutritional goals, which allows me to be able to work holistically with the whole family dynamic. Now, when working with the parents of my kiddos, I look at nutrition, chronic stress, potential nutritional deficiencies, which leads up to the close relationship of adrenal function. So let's get started and dive into the nutritional intervention and support for adrenal health. So the connection between blood sugar and cortisol. We've talked a lot about the cortisol and blood sugar, and often it's referred to as the stress hormone. It plays a vital role in regulating our blood sugar levels. When blood sugar drops due to skipped meals or spikes from processed foods, the adrenals have to work harder, producing more cortisol. This creates a strain on the adrenal gland. So very important, what we want to look at blood sugar balance strategies. And to support your adrenal glands, it's important to maintain steady blood sugar levels by eating balanced meals every 3 to 4 hours. This means combining proteins, healthy fats, and fiber-rich carbs in each meal. For instance, a great breakfast might include eggs with whole grain toast, while a snack could be nuts paired with a piece of fruit. However, if you're someone with Cushing's syndrome, maybe having a different strategy. So have a breakfast like scrambled eggs with spinach, tomato, avocado. That's rich in potassium, magnesium, and healthy fats. Have a snack, a handful of almonds with an apple. That has low glycemic and provides fiber. And then look at a lunch, grilled salmon with quinoa and steamed broccoli. You have rich in omega-3s, fiber, and antioxidants. We can wrap our day up with a snack with Greek yogurt with some chia seeds. You're providing calcium, protein, and healthy fats. And finish your day with a nice dinner of baked chicken breast and roasted sweet potatoes and a side of green beans. That's rich in potassium and fiber. And we're breaking up our whole entire day. One of the hardest things, sometimes people have a hard time remembering to eat. So sometimes it helps to meal plan or write this down, what you're looking to do. So key nutrients for adrenal health, and we've touched base on this. Certain nutrients are essential for supporting adrenal function. We're looking at B vitamins, especially B5 and B6. And they're crucial for the cortisol production. Magnesium helps regulate the nervous system and reduces cortisol, while vitamin C is found in high amounts in the adrenal glands and reduces oxidative stress and helps to lower cortisol. So, nutrient sources for adrenal support. And this is my favorite part about being a dietitian is the food. There's so many different varieties, so many different things we can do. We can become artists with our plate. So to ensure you're getting these key nutrients, you can include foods such as whole grains, leafy greens, and poultry for B vitamins. Almonds, spinach, pumpkin seeds are great sources of magnesium, and Brazil nuts, Trina, I every day love my Brazil nuts. So vitamin C, we can find that with our citrus fruits, strawberries, and bell peppers. Great source of vitamin C. So a salad, a spinach salad with strawberries, quinoa, colorful peppers, sprinkle it with some pumpkin seeds and a nice grilled salmon. And now I'm hungry. Now we're looking at some B vitamin sources for adrenal support. These are thiamine, riboflavin. We have our B5, our B6. And as you can see, these are different things you can just add to a salad. Now, adaptogens are natural substances with powerful effects that may help the body adapt to or recover from stress. There are many evidence-based journal articles that detail adaptogen properties and the relationship to health. It is, however, important to note that taking supplements, you should work with your doctor and professionals, such as those on this panel. I will note a few adaptogens for adrenal support and mention some contraindicated adaptogens with thyroid support. So for adrenal support, ashwagandha is particularly effective in lowering cortisol levels. Rhodiola helps reduce fatigue. And holly basil, also known as tulsi, helps with cortisol levels. Now, adaptogens and thyroid health. However, when it comes to thyroid health, we need to be cautious. Ashwagandha can stimulate thyroid hormone production, which can be problematic for people with hypothyroidism. Similar rhodiola may overstimulate those with hypothyroidism. It's always important to consult, as I said, with a healthcare professional before incorporating any of these adaptogens if you have thyroid issues. Now we're looking at anti-inflammatory diet for adrenal health. An anti-inflammatory diet is critical for reducing the burden on the adrenal glands. Omega-3s are found in salmon and flaxseed, help reduce inflammation and support brain and heart health. Antioxidants-rich foods like berries and leafy greens fight oxidative stress, while healthy fats from olive oil, avocados, and nuts help maintain adrenal and overall health. Now we're looking at foods to avoid for the adrenal and thyroid health. Refined sugars and processed, ultra-processed foods can cause spikes in the cortisol and should be avoided. Caffeine can overstimulate both the adrenal and thyroid, especially in individuals with hyperthyroidism. Additionally, timing of meals, as I said earlier, and supplements are crucial to avoid interference with the thyroid medication. So we want to make sure that we're looking at timing and looking at the supplements, because that can have effects with the medication. When overloading our gut with so many ultra-processed foods and refined sugars, this can lead to increased inflammation. And this is where we're looking at the gut, the adrenal and thyroid relationship to your gut. Now, a small look at our gut and the relationship. The gut is often referred to as the second brain because of the strong connection between the brain and the gut, known as the gut-brain axis. The gut is lined with millions of neurons, nerve cells, forming what's called the enteric nervous system. This system communicates directly with the brain, sending signals about digestion, hunger, stress, and even emotions. The gut-brain axis is a bidirectional communication. This system links the gut, the microbiome, with the central nervous system. The gut has a significant influence, as you can tell, a relationship with our adrenal and thyroid health. It also influences how we feel. Beyond just processing and converting our food, it influences many other things. The term second brain highlights how the gut can impact mental health, stress responses, and overall wellness. And the gut health and the hormone production. In our body, The gut is a major player in the production of key neurotransmitters like serotonin and dopamine. And we've talked about serotonin and dopamine before, much of which is produced in the gut. Matter of fact, up to 95% of our serotonin is actually made within our gut. And both directly influence hormone regulation. Many times we may not understand why we feel the way we do. These neurotransmitters are not only crucial for mood, but also impact the adrenal and thyroid glands. If gut health is compromised, it disrupts the delicate balance, leading to stress, inflammation, and hormonal dysregulation. So the nutritional role and the hormonal balance. I love this little graph here of the healthy gut, healthy mind. And this is things that we need to keep on our mind, mindful eating. So how do we support the gut? The right nutrients not only support the gut, but also ensures the body has the building blocks for hormones and neurotransmitters. Probiotics, prebiotics maintain a healthy microbiome, while specific amino acids like tryptophan and tyrosine promote neurotransmitter production. Additionally, as mentioned before, B vitamins, magnesium, vitamin C, they play key roles in supporting the gut and the adrenal function. So once again, I know it's hard to see all of it, but there's some yummy food up on the screen, and those are key to support our gut and hormone health. We're looking to improve gut and hormone health. It's essential to focus on nutrient-rich, anti-inflammatory foods that support the neurotransmitter production. These include the pre- and probiotic foods rich in tryptophan and tyrosine. So many amazing food choices and meals can aid in benefiting your gut. Pick a protein, a fiber, and a healthy fat for every meal. And here you can see different items such as the sauerkraut or kimchi. A lot of people are afraid of kimchi. Kimchi does not need to be spicy if you're afraid of the spice. And then, of course, your tryptophan, we think just turkey, but there's many other ways to get tryptophan. So key foods to support the gut and hormone health. Ultra-processed food, excess sugar, alcohol should be avoided as they can disrupt gut health and lead to hormonal imbalance. It is not always easy to distinguish between healthy and unhealthy, though. Start by reading the food labels to see what's really inside. Might be surprised with how long the list. I swear everything's getting longer and longer as we keep going on. And team up with one of us. We can help you go through that. We want you to enjoy life. However, trying to avoid or exclude foods and beverages that could or do make you feel bad are important. Sometimes it may take up to 72 hours before you're going to feel symptoms. So try to keep everything in moderation, and most important, know how you feel. And lastly, with food comes hydration, sleep, and exercise. Can't get away from that. Staying hydrated is essential as dehydration can cause cortisol levels to rise, putting strain on the adrenals. Equally important is getting adequate sleep, which we've talked about. This allows the adrenal glands to rest and recover, helping regulate cortisol levels naturally. We don't have to be power lifters or do extreme exercises, and which could be counterproductive, as we've stated before, on some adrenal and thyroid concerns. But let's get moving and enjoy small walks. Stand up and move around. If you're sitting at a desk all day, give yourself breaks throughout the day to stand up and stretch. Most importantly, listen and learn your body. Listen to your body, how it feels after you eat, sleep, exercise, the environment around you. We understand how you feel after you eat. Many of us have noted that we've had concerns, our own health. But it's important that you're understanding how you're feeling, what's triggering you. And to wrap up, here are the key takeaways. Maintain a balanced diet with protein, healthy fats, and fiber to stabilize your blood sugar. Include magnesium, B vitamins, and vitamin C to support your adrenal function. Use adaptogens carefully, particularly if you have thyroid issues. Finally, avoid refined sugars and excess caffeine. Keep your cortisol and thyroid levels in check. And thank you so very much. Team up with a dietitian or a healthcare provider and get started.
Okay, wow. I'm going to go ahead and stop sharing my screen here in just a second as I can figure out how to do it. But as I do, I just want to just say, hey, there's a lot of us there. There's a lot. That's right there. It will end here in just a second. Okay, I hope so anyway. Okay, well, guys, just super, let's see, is it doing it? Nope, I'm still not doing that. Okay, I'm just going to go back to the PowerPoint because it's better to look at. Guys, hey, thank you so much, Grady, for that really informative and well-balanced description there. Let's see, I feel like that was a really nice balance between Trina's, which was very specific with a lot of the exact amounts of iodine and ashwagandha and stuff, and yours, which really kind of like flowed a lot differently. So thank you so much. And there was some overlap there, but I thought it was really great to hear that from two very synergistic voices saying very similar things in some regards, but differently. And I think that we all have, there's an audience for all of that. So thank you so much for both of you for making that so tangible and so accessible. I think that everybody did a phenomenal job. I know we've covered so much ground. I think that we do have a couple of questions that had popped up. And so as I apologize for kind of hanging on to the screen here the way that it is, I wanted to see if there was anything that any of the presenters wanted to add while we were looking through the chats for some questions. As we kind of went through the interventions there at the end, I think that there was a couple things that I know what people sometimes do differently. Does anyone want to share, any tidbits about what they would like, how they work with their patients under certain circumstances?
I'll start. Sometimes whenever you are feeling stressed and overwhelmed and life feels very heavy, it's hard to make anything happen, like to get anything moving and anything going. And so usually I'll have them pick like maybe two things that they can really just laser focus on, those two things. And that might be enough water, or it might be like just getting to bed at a normal time, at a consistent time, like two just very simple things. And then once we start with that start the ball rolling, the motivation and the you start feeling a little bit better, and then it's a little bit easier to kind of build on a foundation that you get started with.
I'm glad you said that. There's so much here, right? Baby steps end up being the way, for sure. Oh, I do have a question here. A question for Lisa. One of the questions was, about levothyroxine. As you were prescribed levothyroxine, did it help?
Lisa,
unmute. Oh, she muted. Okay, thanks.
Okay, there we are. I did not take levothyroxine. Well, I did for just a little bit. It did nothing for me.
Okay.
So that did not help me. Again, what has been laid out to you, and then also working with the dietitian, those are the things that helped me out. But now that after I became a dietitian, started to look back, I could see with the triggers as to what started me down the path. And then I was able to, go back and fix those and help me regain my health.
Okay, all right. So, sleep came up a couple times related to adrenals. And, it seemed like that seems like something that so many people struggle with. So one of the questions, and I'll paraphrase, really is directed at all of us to say, okay, well, I understand sleep's important. How do I get better sleep? And that is opening up a can of worms. Does anyone want to jump in?
I'll jump in on that one. I like to kind of reverse it. Think about what time I have to get up in the morning, and then it kind of helps me. Okay, you know what? I'm now at a point in my life where I need at least 9 hours. I need 9 hours in the bed, or I'm not a happy camper. And I mean, it used to be 7. Hey, no problem. But again, age does wonderful things to the body. And so then I backtrack. So then I think about that. So then I just make sure my nighttime routine. Now, I'm blasphemy. I hear, they say to, cut off electronics 2 hours before bed. If I don't do it, I'm not going to tell my patients to do it. So these are blue light glasses. I look at a computer all day long. I look at my phone. I look at, TVs. So these things are amazing. It helps me. I can maybe play a little game in my downtime before bed, and then help myself well off to sleep. Breathing is another nice thing. So another thing with getting older, we have a tendency to get up in the middle of the night and go to the bathroom and get back in bed, and I'm all excited that I have all these extra hours of sleep, and then I just lay there, and then my brain starts going about, okay, what didn't I do? What do I need to do tomorrow? And then if I focus on my breath, all that stress management thing, the diaphragmatic, and then I count my breathing. If I count my breath, how my inhalation, make sure my exhalation lasts longer, then I don't think about, okay, I've got to feed blah 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 tomorrow. I've got to take my trash out. Blah. So anyway, I usually get to maybe 10 at most, and then boom, I'm out. So those are just some things that help me. Yeah.
Oh,
I like to
gotcha.
second that. I like to second that with Kate when it comes to sleep, and I've learned and kind of discussed this when it comes to a sleep regimen, some suggestions with my patients and clients. Understand what your productivity zones are. And there's productivity zones that range from where you're green, where you're most productive. I'm a morning person. I'm 4 a.m. Yes, 4 a.m. even today. So I'm right now. I'm well into the beginning of my red zone at 7:30 on the East Coast. So, but it's okay. I'm well stimulated with this presentation, and that's fine. So, but when it comes to your green zones, that's how you want to establish your routine and understand that backwards reverse kind of planning and understanding where you're most productive at. That would be your green zone, where you're kind of losing that productivity, and you kind of is kind of leading off a little bit. You drift into that yellow zone where you might want to structure activities to complement a yellow zone type level of productivity, and then into that red zone. So if I'm in a red zone like I am, into my red zone starts about, my husband would tell you 6 o'clock, but it starts about 7 really. I really need some stimulation and a rest prior to that. So if it helps to understand those productivity zones, and then that red zone is definitely where you're powering down and you're settling into a good sleep routine, and honoring that that sleep hygiene, because deprivation is a killer. It's hard to get that back. Sometimes it takes 2 or 3 times the amount of sleep lost to recover when it comes to sleep hygiene.
Wow. Yes. I love that you said that, Trina. I am a 4 a.m. Up, rise and shine kind of a gal too. And so I like the way you do that with the red zone, green zone. Mine's funny because I need to take a little break around 3, but then I can come back with a vengeance. So I come back. Don't call it a comeback. Hey, we've got one more question, knowing that Trina's ready for Betty Bye. I've got one that says to Daphne, I've just been diagnosed with Hashimoto's disease, but my doctor just prescribed me thyroid medication and hasn't mentioned any other way to treat it. What do you recommend? How would you treat it? And I know that's a big question. We did a lot there, but to Daphne, how would you answer that question?
So thinking about Hashimoto's, remembering that it's stemming from the thyroid, but it's actually an immune issue. So it's an immune problem or issue that your immune system is attacking your thyroid. So while we do need to treat the thyroid, we really need to look at it as an underlying immune issue. And so most of your immune system, like 80% of your immune system, lives in your gut. So we really do need to double down on gut health and make sure that you aren't having things like intestinal permeability, making sure that you're getting, again, the nutrients that you need to support the thyroid function. So that zinc and selenium and iodine if needed. So we have to look at it as from a bigger perspective and look at it more from the digestive system and eliminating food sensitivities or potential food sensitivities, and really supporting. I think of it as like, what are we taking out or are you taking away? And usually with Hashimoto's, gluten is a major thing that needs to be removed. So we take out gluten, but also what are we adding in? And so we need to add in foods that are anti-inflammatory. So that's where things like your omega-3s are going to come in. So your salmon and walnuts and ginger and turmeric, and looking at from an anti-inflammatory perspective. So it's not just a thyroid diet at that point. We're looking at the whole immune system and how we're going to address the immune system. And to be fair, most doctors don't recognize it from that perspective, so they don't really see it that way, and they don't really deal with the underlying part of how to manage the immune system from a GI perspective, unless maybe it's your GI doctor. So they do what they know how to do, and that's just to write the prescription for the medication. And beyond that, it's kind of out of their hands. They don't really have the information needed to be able to guide you in that direction.
Or the time. And I think that's exactly where coming together with a registered dietitian makes the most sense for so many people. Insurance usually covers visits, often unlimited, and so in that case, whether it's insurance or whether it's self-pay, because I know some dietitians don't take insurance, because you have the time to get in there and really allow your body to heal itself by giving it the nourishment and the lifestyle it needs to combat whatever it's dealing with. So agree to think that medical nutrition therapy is the starting point for so many people to heal naturally, no gimmicks, just whatever is necessary for your body to heal. It's one of the last few sort of purest services that exists for those of us who want to do things sort of the right way, so to speak. So allow your body to heal, live your best life ever. Get yourself connected with the registered dietitian nutritionist. We put the links to each schedule for each provider in the chat. You can also reach out to LWell at LWell.com to be connected with any of these dietitians. So thank you so much, everyone, and we will connect again soon, I hope. All right, bye guys.